Hey student, welcome to our today's lecture. In a series of drug acting on mental illness, today we are going to see antipsychotic drugs, drugs used in treatment of the psychosis. These are also called as neuroleptics as well as major tranquilizer. In this video, we are going to see what do you mean by psychosis, what are the different drugs to be used for the psychosis, treatment of the psychosis, what is the mechanism of action of this antipsychotic drug, in what manner it produces its pharmacological action, possible adverse effect, and therapeutic effect of the drug used in treatment of the psychosis. So let's start with this drug used in treatment of psychosis. So before that, first we will see what is a psychosis. Generally, psychosis is get categorized in two types. One is organic psychosis and second one is a functional psychosis. When we can call it is an organic psychosis, when a brain functioning is caused by a physical abnormalities like some organic disease of the brain or due to some any accidental events. Patient get suffer from that called as an organic psychosis. While the brain function is get altered because of this hallucination and delusion, then we can call as this is a functional psychosis. So there are few drugs which could be used for the treatment of this functional psychosis. So today we are going to see what are the different drugs and what is the mechanism of action of these drugs working for that functional psychosis. So let's start with this. First one is what happened in psychosis, and when we are going to treat as an antipsychotic, it has a particular specific action. These are the drugs which are having salutary, that is the improvement therapeutic efficacy in all type of functional psychosis. Particularly, that example is in schizophrenia. What happened in schizophrenia? In schizophrenia, the dopamine level is get increases and there is an increase in a dopaminergic activity. And due to this increase in a dopaminergic activity, the patient is get suffer from a psychosis. So this is the main point, that we need to control the dopaminergic activity. So this is the main bottleneck, that dopaminergic activity, hyperactivity of dopamine. So we need to control this dopaminergic activity. That in mechanism we are going to see in what manner it does produce its action. And these are the agent. Because of that, this agent improves the behavior of the patient, and that's why they are called as an antipsychotic, as well as it is called as a major tranquilizers. Examples which are used for the psychosis like chlorpromazine, trifluoropromazine, pyridazine, trifluorazine, cleopenazine. These are some common examples which could be used as an antipsychosis. So drugs which are used in treatment of the psychosis, they are classified like this. First class, that is a phenothiazines. The example that we just seen, that is a chlorpromazine, trifluoperazine. These are the class of the phenothiazines. Second class is that as a butyrophenone derivatives, haloperidol, trifluoroperidol. These are the examples of the butyrophenone derivatives. Third class, that is called as thiothixane derivative. Thiothixane derivative, the example of thioxanthine is an example of thiothixane derivative. Fourth one is a Ralphia alkaloid, which is the famous example, that is a reserpine. That is a famous example is a reserpine. So these are the some class where we could use as a major tranquilizer. Along with this, diphenyl butyl piperidine derivative, that is a pimozide, is one of the very famous molecule which could be used for the treatment of the antipsychotic drug, as well as the fenfuridol is also one of the famous molecule used for the treatment of the psychosis. So these are the examples, or these are the classification for the antipsychotic drugs. Antipsychotic drug. In that, we are going to discuss about today we are going to discuss about the phenothiazine derivatives, how the phenothiazine derivatives are acting as an antipsychotic drugs. Let's see. Most widely used compound for the treatment of the major psychosis, and that molecule is chlorpromazine. That molecule is chlorpromazine. This chlorpromazine is also called as largactil. Largactil, this name largactil, that is a large pharmacological action, largely acting, that is a large pharmacological action. It is also asked for the exam point of view, and in many times, particularly in question number 6 Q reason, they have asked about chlorpromazine is called as a largactil. Why? This is the reason. And what is the mechanism of action? Particularly, this drug shows that, as we know already in psychosis, there is an increase in activity of dopamine, dopaminergic hyperactivity. So, what this phenothiazine derivative does, all these phenothiazines have potent dopamine receptor blocking action. Potent dopamine receptor blocking action. And in that dopamine D1, D2, D3, D4, D5, like the total 5 dopamine receptors are available. But with respect to that, here phenothiazine derivatives are blocking D2 receptors. They are blocking D2 receptor. And as we know very well, if the receptors are get blocked, then even though the contents, even though the drug, even though the hormone, even though the neurotransmitter is available at the place, it won't work because for that receptor are not available. The receptors are get blocked. In the same manner, here phenothiazines are get blocked the D2 receptor, and because of that, it act as an antipsychotic action. It inhibit dopaminergic action. It inhibit dopaminergic action. This is the one of the very wonderful important action. In this diagram, we will see in very clearly. So this is another one receptor, and this is another receptor. In this receptor, what happens? All these maximum receptors are get occupied by the dopamine. This one is the red bubble is called as a dopamine, and blue bubble is an antipsychotic drug, or we can say it's an phenothiazine. So what happens whenever these dopamines are get released? Whenever these dopamines are get released, they will go and bind with all the receptors, and they will start to produce its action. As a high amount of dopamine is available and continuously the receptor is available for binding, it will produces its action. That is increases the dopaminergic activity. And because of that, patient is get suffer from psychosis, or patient gives some psychosis like behavior. So what we have to do, we can avoid the binding of this dopamine with this receptor. So that's why here these sites are get occupied by this antipsychotics, means drug get occupied this receptor, and due to occupying the receptors by the drug, the site is not limited site is available for the dopamine only one here, only one site is available for the dopamine. So only limited action will produce by the dopamine, and thus this antipsychotic effect is get reduced. This is the most important thing, that is the D2 receptor is get blocked by this phenothiazine like derivative. Due to blocking of its action, it reduces its further action, its further activities. What are the further activities like? Further activities like, particularly if you see this, it reduces the irrational behavior, agitation, aggressiveness, as well as disturbed thought, behavioral, and gradually normalize the anxiety. That is one of the very important thing. It gradually normalize the anxiety, hyperactivity, hallucination, delusion. These are also get suppressed, as well as it reduces the seizure threshold and can precipitate the fits into the untreated epileptics. It also exerts an anti-emetic action through the chemotrigger receptor zone, but it is ineffective in motion sickness. It will not work for the motion sickness. Many times, for exam, this point is very important. Many times in exam, we ask for the question number 3, that is motion drug of choice for the motion sickness. As it is anti-emetic, many students are trying to write that as a chlorpromazine is an anti-emetic drug. It is used in treatment of the motion sickness, but particularly this drug doesn't work for the motion sickness. So these are the some symptoms which are get reduces because of the phenothiazine, because of the blocking of this dopamine activity, because of the reduction of the dopaminergic activity. That is the main most important thing. And by addition of this, along with this, we it also has some pre-anesthetic medication, also pre-anesthetic work also. So by thinking all this we can say that chlorpromazine is called as large active because of this specific wide range of activity. It called as a large active because whenever the psychiatric psychosis patient is there, the psychosis patient is having these all activities, that is irrational activity, agitation, aggressiveness. There are quite often anxiety, disturbed thought, hyperactivity, hallucination, delusion. These are the some points which are very common with the psychosis, and with the chlorpromazine, all these symptoms are get subsided. All these symptoms are get reduced, and because of that, majorly this chlorpromazine used in treatment of the psychosis. This is the most important mechanism of action of the phenothiazine. This is what mechanism action. Then next, what are its possible pharmacological action on central nervous system? Individually, it has some different actions. There is a little bit changes in their action, but particularly with respect to the surrounding, some psychomotor activities are get slows. There is a reduction in emotional activity. There is quietening in emotional activity, reduction in initiative, and to go off to sleep, from which subject is easily arousable. He can get again awake because as it is a CNS depressant action. Sometimes if we use, many times what we feel that he is unexcited, he is get aggravated, he has aggressiveness, and because of the aggressiveness, it is necessary that we could give a CNS depressant effect. If we are going to give a CNS depressant action, then in this case, patient major time he will go for the sleep. It is not a normal activity. It is not a normal activity. What we want that whenever he is getting aggressive, he should get quiet. That is the main intention behind that. But due to some hypnotic sedative, it is not workable. But this point, this particular chlorpromazine, it produces quietening, emotionally quietening us. It reduces emotional activity, produces emotional quietness. And due to the emotional quietening, it surrounding activities get reduced, and as well as a reduction in initiative to go off sleep, and the subject is easily get arousable. That is one of the very important thing within a CNN. And because of this, it is called as a neuroleptic syndrome or neurosis. Second thing is with respect to the autonomic nervous system, it acts on a both way by the central as well as by the peripheral. Centrally, it get depressed at the hypothalamic level, and at peripheral level, it blocks the alpha adrenergic blocking action. Alpha adrenergic blocking action. This is action on a autonomic nervous system. It is act as a local anesthetic. It is a potent local anesthetic, but not used as a local anesthetic due to its irritant nature. What is its effect on cardiovascular system? It produces hypotension acting on central as well as the peripheral sympathetic system, because it's an alpha adrenergic blocking. There definitely there is a decrease in a vasoconstrictory effect. So there is a peripheral vasodilation. So hypotension is quite possible. Centrally, it decreases sympathetic tone and peripherally by blocking alpha adrenergic receptor, and thus it produces vasodilation, and there are chances of hypotension, and there are possibility of reflux action which results into the tachycardia. Then what are its possible adverse effect? Its possible adverse effect on central nervous system, it produces the effects like drowsiness, lethargy, mental confusion, aggravation of seizures or epilepsy might be possible sometimes. With alpha adrenergic blocker, due to the alpha adrenergic blocker, it produces postural hypotension, palpitation, as well as inhibit the ejaculation also. This is a quite possible. Next one is there might be a possibility of amenorrhea as well as the infertility. Amenorrhea, that is the absence of menstruation, that is called as amenorrhea. Infertility, unable to conceive, that called as infertility, as well as some extrapyramidal disturbances seen with adverse as an adverse effect with this molecule, as well as these are the dose limiting side effect as the Parkinsonism symptom like a rigidity and tremor, muscle spasm, restlessness, and feeling discomfort. So why we call as a dose limiting? Because there is a dopamine as level of the dopamine. Already we had seen in Parkinsonism what is the role of dopamine in Parkinsonism. If the quantity of dopamine is get decreased, then definitely there is a Parkinsonism. But if here in this psychosis, dopamine activity is increased. We are trying to reduce the dopamine activity. So whenever there is a excessive dopamine, decrease in dopamine activity, we could face the Parkinsonism. But as we are trying to reduce the dose or change the dose, then definitely instead of decreasing excess level of dopamine, we could only try to maintain a sufficient dopamine level in a brain. That's why they are called as dose limiting side effect. So these are what about the side effect. Next one is therapeutic uses. So already we have discussed that is it is one of the very wonderful antipsychotic drug because of its specific some actions like it reduces agitation as well as some schizophrenia and mania like symptoms they are also get reduces. It is an act as an anti-emetic drug acting on CTZ and it produces anti-emetic drug. And last one is it is act as a pre-anesthetic medication. So these are its specific therapeutic applications that about the chlorpromazine. So this is what about the major tranquilizers that is an antipsychotic drugs. That is an antipsychotic drugs. So in this lecture, we had seen about what is my psychosis, what is the role of chlorpromazine, in what manner it produces as an antipsychotic action, why chlorpromazine is called as an largactil, what are its possible pharmacological actions, and what is a therapeutic action. So this is what about the today's lecture. If anything you need about this chapter, let me know. I would like to create you. I would like to produce you more things about this. Thank you very much. Thanks for listening.